Chapter 8: Creating a Climate of Health and Wellness. Health is defined as a state of complete physical, mental, and social well-being. Again, a lot of times in schools, the focus is on a child's mental health. But for a child to really have a complete sense of well-being, there should be a focus on the physical and social well-being of the child also. For good physical health, a child or adult needs proper nutrition, exercise, and rest. So we're talking about the condition of the body. For social-emotional development, children need healthy relationships with teachers and with caregivers. These areas of physical and mental health and social-emotional well-being are all interrelated and affect one another. So if a child has a chronic disease, then that could affect the mental well-being of the child as well. Wellness is defined as optimal health and vitality to enjoy life. So this is determined by lifestyle choices, such as eating healthy foods, being in safe environments, and having access to healthcare services. There are many factors that affect children's health. The social and economic environment can affect a child's health, as well as the physical environment and the individual characteristics and behaviors of the child. The socioeconomic status is one of the biggest factors. If a child is living in poverty, that's going to affect their ability to access health care and nutritious foods. It could affect their ability to live in a safe neighborhood and many other factors. When we talk about risk factors versus protective factors, again, poverty is one of the biggest risk factors because it does influence so many areas of the child's life and well-being. However, if the child does face one or more risk factors, it's important to note that one of the protective factors is a warm relationship. So you can affect the children in your care by having a warm relationship with them, helping them to access wholesome foods, and possibly providing the family with additional resources and community supports as well. If you have a child who is living in poverty, it could also affect the parent's mental well-being. So again, if you can point them in the direction of community resources that might be able to help them, that is a protective factor for the child, as well as, of course, helping the family. There are things that teachers can do to influence health and wellness of the children in their care. Teachers can provide opportunities for children's active play in safe indoor and outdoor environments. So it's really important for children to have time outdoors to play every day, and it should be more than 15 to 20 minutes, and there should be multiple opportunities for children to play outdoors. If there's the case where the weather does not cooperate and children are not able to go outside on a certain day, there should be active activities indoors, especially, like I said, on those days when children aren't able to play outdoors. I used to observe student teachers, and sometimes I would see student teachers and teachers that would use that active outdoor time to read books inside instead because they were unable to go outside. And while reading books is a great activity, it's still important to make sure that children get that active time to practice physical skills and just to move around and have a break from sitting still. I will list the resource for developmentally appropriate practice on the course syllabus, but it is recommended that children in full-day kindergarten programs, as an example, get 60 minutes of free choice playtime indoors every day. So that could be active play, but they are free to choose their own station and to engage in the activity of their choice. You could incorporate in your classroom a center for physical movement. Young children love to move to music, so music and movement activities are a good way to get children moving also. Resources for health policy development. Health policies are a requirement for a licensed program, but there are many resources that teachers can use. There are National Health and Safety Performance Standards, as well as Head Start Performance Standards, which outline health, safety, and nutrition policies for Head Start programs. And the NAEYC, or the National Association for the Education of Young Children, also offers accreditation for high-quality programs. They have health, safety, and nutrition standards as well. Components of health policies are listed here. One of the main things is prevention goals. So of course, in any early childhood program, teachers and directors and principals want to do everything they can to prevent illness and injury to the children in their care. As far as ensuring procedures are practical and specific to the setting, it's important to get advice from health workers in the community who can help in this area. Children's oral health is an important component of their overall health and well-being. Childhood tooth decay is very preventable available with education and resources. When I taught preschool, I always had a dentist. This was in Omaha, Nebraska, but I always had a local dentist come and talk to the children about brushing their teeth. But he was a pediatric dentist, so he was very engaging for the children. He actually sang songs with his guitars about cavities, and he had a horse puppet named Elvis with really big teeth, so he could talk to them about how to properly clean their teeth and what would happen at the dentist. So that is something that you can do. You can involve the community and have a dentist speak to the children so that they can learn about taking care of their teeth that way. In addition to that, there are lots of good children's books and songs about brushing teeth and visiting the dentist as well. Many programs actually provide toothbrushes to encourage children to brush their teeth during the day. That's good practice for children, and then it may help them remember to brush their teeth when they're at home too. Promoting physical activity. I touched on this a bit already, but the recommended minimum of physical activity for children is 60 minutes of moderate to vigorous physical activity per day. A lot of times children don't get the opportunity to get active time outside of school. A lot of times they might be watching TV, or they might be in organized activities that may or may not incorporate moderate to vigorous physical activity. So it is very important for teachers to do everything they can to incorporate that physical activity throughout the school day. And of course, physical activity for children, it promotes their physical growth and development, as well as their social, emotional well-being and brain functioning too. In order for teachers to incorporate this physical activity, it's important for them to have training and education on the importance of it and ways to actually implement physical activity throughout the day. Again, children should have multiple outdoor recess breaks. It's nice if they can be a bit longer, but it should be multiple breaks throughout the day as well. And then it's been shown that there's a lot of benefits to children having access to natural materials and open areas when they do play outdoors. So instead of the asphalt, maybe there can be some areas where children can play that are grassy fields with trees and flowers and other types of vegetation. Recognizing stereotypes and prejudice. The definitions are here of stereotyping, prejudice, and discrimination. It's very important for teachers to reflect on their own beliefs and to work to avoid discriminatory practices when they are teaching children, but also to intervene when they see discrimination among the children in their care. Teachers also need to promote acceptance in their classroom. So you can do activities with young children about how they are all alike and how they are different, and teach them that it's a good thing that we have differences and that we can complement each other and share our strengths with each other. I think one of the main goals in early childhood education should be teaching children skills such as problem solving and negotiation. These are skills that actually a lot of adults are still lacking. So if you are going to teach young children, you need to make sure that you're developing the skills that you want young children to be developing also. And you need to see conflict as an opportunity. Sometimes it seems that conflict is taking time away from other lessons or activities that we have planned. But again, it is a very important skill for children to learn how to solve their own problems and negotiate conflict with their peers. So when that happens, you can take the time to teach them how to listen to each other, how to brainstorm solutions, and you can have props and areas available for problem solving and conflict resolution. Some early childhood classrooms have a specific peace table or an area where children can go. You can use puppets and role play to help children learn these skills as well. When I have done role play to help children learn social skills, they have really enjoyed it. And what we would do sometimes is have the adults act out a situation and do it incorrectly and have the children tell us what we did wrong. They always enjoyed that. Supporting families who do not speak English. One way you can support families who do not speak English is, of course, to have an interpreter available for parent-teacher conferences and any type of schedule meeting. However, this might not always be possible, so you may involve family members as interpreters, but understand that the interpretation might not be as accurate as with a trained interpreter, as well as if you have confidential information to explain to the parents, using a sibling might not be the best way to to communicate with those families. Any important information that you're communicating with families, any newsletters, health policies, things like that, should be translated into the family's native language for families who do not speak English. Of course, if at all possible, it's nice to advocate for the hiring of bilingual teachers in your program, but English-speaking teachers can also learn a few key words and phrases in another language to make the child and family feel more welcome. Depending on the native language, this might be a little more difficult. When I taught preschool, I had many children that spoke Spanish as a home language, and I did have some Spanish background as far as high school courses, so I was able to sort of practice and learn some of those common phrases again in Spanish to communicate with the children and the families that I was working with. So if possible, that can be a real way to just show the families that you appreciate their language and that you're doing what you can to reach out to them and communicate effectively.